Hi, I'm Dr. Harry Adelson, Humanaut Health co-founder and Chief Regenerative Medicine Officer. Now I'll talk about regenerative medicine for pain of the spine and joints. At the end of this video, you'll have hopefully received enough information to decide if you'd like to take the next step and schedule a medical consultation for the pain of the spine or joints you've been living with. You'll need to schedule a consultation with one of our licensed medical providers to receive medical clearance for treatment and discuss personal questions. Our administrative and scheduling staff will not be able to address personal medical questions and will not be able to answer regenerative medicine questions beyond this video series. Before we begin, I need to share two important messages. The content covered in this series of videos is for general information purposes only. It's not intended to be a substitute for professional medical advice from your doctor, nor is it intended to prevent, diagnose, or cure any serious medical condition or disease. The use of stem cells and/or human cellular tissue products is not FDA approved to treat any disease or medical condition. The medical therapies performed at Humanaut Health, including regenerative medicine, do not claim to diagnose, treat, or cure any serious medical condition or disease. My entire 25 years in private clinical practice has been working with folks living with chronic pain of the spine and joints. The most simple explanation of how we think regenerative medicine contributes is this. We believe that it supports the restoration of health to suboptimally healed connective tissue. I discussed this in the first video of this series, but it bears repeating and I'll keep it short. For those of us practicing regenerative medicine, we believe that the majority of chronic musculoskeletal pain is caused by changes in the microscopic connective tissue. First, the miracle fabric that's your connective tissue loses its miracle properties. It stretches too much in some directions and not enough in others. Second, you grow a hyperconcentration of irregularly formed blood vessels. This means that in addition to losing the ability to bring oxygen to the area and metabolic waste away, anytime you grow a new blood vessel, you grow a sensory nerve along next to it. So now you have a hyperconcentration of sensory nerves in an area that cannot be sufficiently oxygenated. We think the mechanism of action of personal stem cell therapy is by tricking your body into thinking that it's undergone a new injury without causing any true tissue insult. You launch the body's natural healing cascade and give these areas of suboptimal healing an additional chance at healing. We think the mechanism of action of using human cellular tissue products from umbilical cords is by attempting to restore the original relevant characteristics and basic functions of your spine and joint tissue. Who is and is not a good candidate for regenerative therapies for pain of the spine and joints? The scientific data tells us if you do MRIs on 100 people over the age of 45 who've never experienced low back pain, it turns out 60 of them will show irregularities on MRI. 15 will have irregularities so significant if they had corresponding symptoms, which they don't, they would be candidates for immediate emergency surgery. Similarly, when you look at people with debilitating low back pain, frequently their MRIs are perfectly normal. This brings us back to the concept of what we believe the most common cause of chronic pain: changes in the microscopic anatomy. Those of us practicing regenerative medicine believe that the pain is coming from the very suboptimal healing that may not show up on MRI. This is the very situation among those that respond the best to regenerative medicine. People who are otherwise in good health, who have pain of the spine, and who may or may not have irregularities on MRI. This is why we depend so much on what it is that you're telling us during your medical consultation to make a recommendation, and the decision-making is not made on looking at the MRI alone. Similarly, while we hope to see improvements in your level of daily pain, your activities of daily living, and your quality of life, we likely will not see any improvements in your imaging. This is because your pain and your pictures frequently don't even correlate at all to begin with. People who are not the best candidates for regenerative medicine and who may be best served speaking with a surgeon are folks who have signs and symptoms suggestive of instability of the spine and whose MRI show likely instability. Here are a couple of red flags I listen for. Pain that's entirely in the legs or arms and none in the back or neck. Pain that comes and goes very suddenly. Any sort of motor nerve loss like drop foot or difficulty holding items. Any sort of incontinence at all. These are all pretty much immediate surgical referrals. Similar to pain of the spine, pain of the joints may or may not present with imaging that necessarily corresponds with the person's pain. Lots of people have torn rotator cuffs and have no pain at all. You might have shoulder pain and a rotator cuff tear, and the pain has nothing to do with the rotator cuff tear. Similarly, you might have a painful arthritic knee, but your x-ray really doesn't look that bad at all. This is why the consultation with your Humanaut physician is so critical in our being able to make a recommendation for you. While we obviously take your x-ray or MRI into consideration, we base our recommendations much more on what it is that you tell us. We ask you a very specific series of questions, and then we really listen to what you tell us, because in many cases, it gives us much more relevant information than the diagnostic imaging does. Having said that, people who are not the best candidates for regenerative medicine and who may be best served speaking with a surgeon are folks who have truly bone-on-bone arthritis, especially to the point where the shapes of the surfaces of the bones have changed and the symptom picture corresponds with the pain and dysfunction. These people unfortunately need joint replacement. Similarly, people who've had significant changes in the function of their joints that get stuck in place or pop and click into place, are less likely to benefit from regenerative medicine than would someone who simply has pain. What can you expect from treatment? Prior to the procedure, clearly, you will have undergone the entire onboarding process, which includes filling out some basic paperwork, getting us any x-rays or MRIs that you may have, and having a 30-minute consultation with our Humanaut physician. It's critically important that you tell us everything about your health, your use of medications and drugs, and your alcohol and tobacco use. Any information you withhold puts you at risk of, at best, an inferior outcome, or at worst, an adverse outcome. Leading up to your procedure, please do not undergo any sort of fasting and show up not too hungry but not too full. Clearly, if you're undergoing IV sedation, you'll have very specific instructions around that. During the procedure, first you'll be checked in and you'll change into a gown. Then you'll be brought into the procedure room. If you're doing the procedure awake, you'll have the option to use nitrous oxide, also known as laughing gas. First, you will undergo the shockwave treatment, which is relatively painless. Then your skin will be prepped and cleaned. Then a small amount of local anesthetic will be injected, followed by the deployment of the regenerative medicine. All implantations are performed either with ultrasound or x-ray guidance. Clearly, if you're undergoing IV sedation, the flow will be quite different, and all aspects will be explained to you ahead of time. After the procedure, we'll keep you in the clinic for a time to make sure you're not dizzy or in pain. If you underwent IV sedation, we'll keep you quite a bit longer, and you'll have very specific instructions and will not be able to drive the rest of the day. At this point, it's critical that you take it very easy for 1 week, then the second week you introduce normal daily activity, and for 2 months, you must not have any new injuries. The way we think this treatment works is by tricking your body into thinking it's been injured without actually having done any harm. Well, if you go ahead and fall off the roof of your house or have a mountain bike crash, that's not helping you on the pathway to healing, right? Be patient with your recovery, and remember, the Humanaut team is rooting for you. Thanks for watching. If you want to see if regenerative medicine is right for you, I invite you to visit humanaut health.com to start the medical eligibility process.